I get asked sometimes, what is addiction? Is it a choice? Is it a disease? A lot of people don't understand it. And they wonder, why is it that people do the things they do with substances? Well, actually, we don't even call it addiction anymore. That's a pejorative term. We call them substance use disorders. We say these are patients with substance use disorders rather than saying someone is an addict or an alcoholic. So what is that? Well, what we know about it is that it is a brain-based disorder of the reward circuitry in the brain. Now that sounds kind of fancy and scientific, but what it means is the part of the brain where we feel good gets hijacked by chemicals. And those chemicals are chemicals like alcohol, methamphetamine, heroin, oxycodone, marijuana. All those different chemicals can take over the brain's ability to control the reward mechanism. And unfortunately for us, the reward mechanism is closely tied to the survival mechanism inside the brain. So when, for example, someone who is using heroin is 6 or 8 hours after their last dose of heroin, they don't feel like it would be nice to use heroin right now. They feel like they're going to die if they don't get some. That's the driving force behind it. And I think that's the thing that most people don't understand. They didn't bring this on themselves, these folks. They didn't cause their addiction. In fact, we have very good evidence that the structure and chemistry involved in substance use disorders pre-exists the use of any chemicals. And so there's like this fertile bed inside the brain for developing a substance use disorder. And the earlier the chemicals are used in life, the more likely someone is to develop one of these disorders. And the problem that we have in our society is that since people don't understand it as a disease, they don't necessarily feel like there's any treatment that would be appropriate for this kind of condition. In other words, people with these conditions simply need to stop doing what they're doing. Well, in most cases, they would if they could. They simply can't. They're compelled to do these things. They're compelled to these behaviors by this brain-based disorder that causes them to continue to do it. Now, a lot of people out there in society say, well, that's just a cop-out. You're just calling it a disease to give them an excuse to continue their bad behavior. Well, that would be nice if it were true, because then we could punish people into sobriety. But that never works. But what does work is effective treatment. And maybe, if you're lucky, you'll hear about that soon. And that's all I got to say about that for now.